Men over 50 massage this forbidden spot before bed. The results are shocking. That's not clickbait. I'm Dr. Julia Morgan, the board-certified urologist, and in the next several minutes, I want to show you a single external, coin-sized point you can stimulate for just 60 seconds before bed that many men report helps with circulation, sensitivity, bladder control, and overall confidence. It's simple, it's safe when done correctly, and it's something you can do in private at home. If this sounds like the kind of practical, non-pharmaceutical approach you want to try, go ahead and hit like and tell me where you're watching from in the comments. I'll read a few during follow-up videos. Let me start by reframing the problem so you don't waste time blaming the wrong thing. When men over 50 notice changes, less energy, more nighttime trips to the bathroom, duller sensation, or reduced confidence, most people immediately point to age or low testosterone. Age and hormones do matter, but they aren't the whole story. Much of what changes with time can be traced to mechanics, the way pelvic tissues, blood vessels, and nerves behave after decades of posture, stress, and reduced movement. Think of it like plumbing and wiring in an old house. If the pipes are kinked or the wiring is damp, the fixtures don't work as well. Your pelvic floor muscles and the tiny vessels and nerves crossing that area can tighten, get crowded, or lose some of their responsiveness. The result is restricted blood flow and nerve signals that don't fire as crisply as they once did. To put this in everyday language, imagine a garden hose that's been folded over behind a rock for months. The water pressure drops. Or picture a highway at rush hour. The lanes become jammed and cars slow to a crawl. A similar thing happens in the pelvis when pelvic muscles are chronically tense or when circulation is sluggish. That tension acts like a rubber band around small vessels and nerves, making it harder for blood to get in and for signaling to happen efficiently. That reduction in flow and tone affects sensation, nighttime bladder control, and the subtle mechanics that contribute to sexual confidence. The good news is that the body remembers how to work. Small, consistent interventions can reduce that tension, improve microcirculation, and help nerves recover some of their responsiveness. 1 minute a day is all we'll ask, but it has to be the right minute, practiced correctly. Now, briefly, why stimulation at a small external point can help. When we gently stimulate the skin and soft tissue at the perineal area, the external region between the scrotum and the anus, several physiological responses can occur. Mechanically, gentle pressure and massage relax nearby pelvic muscles. From a vascular standpoint, tactile stimulation can encourage local release of nitric oxide, a compound the body uses to dilate small blood vessels. When vessels dilate, blood flow improves. Tissues receive more oxygen and nutrients, nerves get better metabolic support, and the soft tissue feels less tight. Think of nitric oxide as a traffic director opening another lane on the highway so vehicles can move freely. Nervous system-wise, light, controlled stimulation can reduce protective tension in muscles that have been guarding for too long, allowing pelvic floor muscles to release rather than clamp down. We do not promise a guaranteed biochemical change like a defined testosterone increase. Instead, the mechanism is supported by basic physiologic principles and by what many patients describe after consistent practice. So, where is the spot exactly? Clinically, it's often called the perineum in some literatures, but you don't need to memorize the term. It's the small external area midway between the base of the scrotum and the anus, a coin-sized patch of skin and soft tissue. It's external, not internal. You can access it with clean hands, warm oil if you prefer, and a gentle clinical approach. I'm going to walk you through a safe, non-invasive 60-second routine you can do while sitting on the edge of a chair or lying down with knees bent. I'll be precise because technique matters. Pressure, duration, motion, and comfort are the keys. Begin by preparing. Wash your hands thoroughly. If you prefer to use an oil for comfort, warm a small amount in your palms. A teaspoon of castor oil, fractionated coconut oil, or black seed oil are all acceptable choices. Each has a long history of topical use for comfort, though none is a guaranteed medical cure. Castor oil is thicker and can provide a soothing glide. Coconut oil is lightweight and antimicrobial, and black seed oil has a traditional reputation for anti-inflammatory properties. Use what feels best on your skin. Place a towel on your lap if you're sitting and want discretion. Position is important for relaxation. Option 1. Sit on the edge of a firm chair, feet flat on the floor, knees about hip-width apart. Lean slightly forward so the perineal area is accessible and the pelvic floor is not actively braced. Option 2. Lie on your back with your knees bent and feet flat on the bed. This is often the most relaxed posture for many men. Choose the position that feels most comfortable and private for you. To locate the spot, place 2 clean fingertips gently on the area between the scrotum and the anus. You're searching for a slightly tender or sensitive point that's about the size of a coin. If you press lightly and feel a soft pad of tissue, that's likely the place. Remember, this is an external touch. If anything feels sharp, very painful, or causes bleeding, stop and contact your healthcare provider. Pain is a warning sign, not a badge of effort. Pressure is a common question, and the best analogy is a ripe tomato. Apply enough pressure that you feel a firm but comfortable compression, not a crush, not a poke. Imagine checking ripeness on a tomato. You want to feel resistance and give, but you don't want to puncture it. If you ever feel sharp pain, numbness, or tingling radiating in a way that worries you, stop immediately and consult your provider. The motion is simple and timed. Option A, circular motion. Place your fingertips on the spot and perform slow circular strokes for 30 seconds clockwise and then 30 seconds counterclockwise. Keep your hands steady, use smooth, even pressure, and breathe slowly. Option B, press and release cycles. Apply steady pressure for 5 seconds, then release for 5 seconds, repeating that cycle 6 times for a total of 60 seconds. Either method works. The important part is consistent, gentle stimulation for a full minute. After the minute, rest for a breath or 2, and then perform 5 slow diaphragmatic breaths to encourage parasympathetic relaxation. Breathe in slowly for a count of 4, hold for 2, and exhale for 6, letting your belly rise and fall. A few practical comfort tips. If the area feels cold, warm your oil between your palms first or use a warm compress briefly to help tissues relax. If you prefer to use a glove for hygiene, that's fine. Just make sure it's clean and change it if it becomes soiled. Avoid soaps or scented products that irritate the skin. Use only light pressure. Don't use any internal or deep maneuvers. If you have any open wounds, bruising, recent surgery in the area, or implants that could be affected, consult your provider before trying this routine. 1 minute isn't much, but consistency compounds. The best time to do this is before bed, which is part of the timer for a reason. Evening practice leverages the body's natural overnight repair processes and helps shift the nervous system toward relaxation. The combination of local massage plus diaphragmatic breathing primes your body for deeper sleep, better overnight tissue recovery, and improved daytime function. That said, morning is an acceptable alternative if evening doesn't fit your schedule. What matters most is daily repetition. There are 2 simple habits that amplify the benefit of the 1-minute routine. The first is walking. A short walk of 10 minutes after a meal promotes pelvic circulation and overall cardiovascular flow. Walking is one of the best low-risk ways to move blood through the lower body and reduce the microstagnation that can occur after sitting. Make a habit of a brief post-meal stroll. It's one of those low-effort behaviors with outsized returns for men over 50. The second habit is diaphragmatic breathing, which I already mentioned after the massage. A brief 4-2-6 breathing cycle, inhale for 4 counts, hold for 2, exhale for 6, practiced 5 times immediately after the massage, supports the parasympathetic nervous system and encourages relaxation and nitric oxide pathways to favor vasodilation. You may be wondering about safety and what to expect. Let me be clear. This is an external, non-invasive technique intended to encourage circulation and muscle relaxation. It is not an internal procedure. It is not a replacement for medical evaluation. If you have sharp pain, bleeding, skin lesions in the area, recent surgery, implants, or any condition that makes you uncertain, consult your healthcare provider first. Do not stop or change any prescribed medications without discussing them with your clinician. The information I'm sharing is educational and based on physiological principles and the experiences reported by many patients. It is not a guaranteed medical cure. Before I give you a few real-world examples, a quick transition. So where do you press? Right here, the small external patch midway between scrotum and anus, and do it gently, 1 minute before bed. It sounds awkward, but it's anatomy, not embarrassment. Many men find the simple routine empowering because it's private, quick, and within their control. Now a few short anecdotal stories. These are illustrative experiences reported by individual patients. They're labeled anecdotal because individual results vary. Robert is 64. He came to my clinic frustrated with frequent nighttime bathroom trips that were interrupting his sleep. He added the 1-minute perineal massage to his bedtime routine and began walking 10 minutes after dinner as I suggested. Within 3 weeks, he reported fewer awakenings to urinate and deeper sleep overall. He also said he felt a subtle improvement in lower pelvic comfort when getting up in the morning. James is 70 and had gradually lost confidence in intimate moments and sometimes felt stiffness in his pelvic area after long days at his desk. After daily massage and the breathing exercises for about 5 weeks, he told me he noticed improved sensation and less pelvic tightness. Not a miraculous overnight change, but steady progress that helped restore confidence. Daniel is 65 and had chronic low back and pelvic tension. He used the massage as part of a nightly ritual along with gentle stretching and the post-meal walk. He reported that his back pain felt less frequent and that the pelvic area felt loosely freer after several weeks, which translated into better sleep. Again, these are individual reports, not guarantees, but they illustrate the kind of improvements many men mention when they combine the massage with movement and breathing. You'll probably ask, how soon will I notice anything? There's no exact answer. Some men notice subtle changes within days, others within a few weeks. Anecdotally, many men report meaningful differences in the first 2 to 3 weeks when they commit to the 1-minute routine every night and pair it with the suggested movement and breathing. That's why I invite you to a simple 3-week challenge. For 21 nights, do the 60-second perineal massage before bed, take a 10-minute walk after dinner, and perform 5 cycles of the 4-2-6 diaphragmatic breaths afterward. Keep a simple note each morning about your sleep quality, the number of nighttime bathroom trips, and how your pelvic area feels. This will help you notice patterns and improvements. If you want to try the challenge, type "ready" in the comments below. If you found this instruction useful, subscribe for more practical, non-invasive strategies for men's health, and share one change you'll make tonight. Again, be succinct and respectful in your comment. My team and I read the feedback and often use it to shape follow-up content. A few practical troubleshooting points you may encounter. If the area feels sore after the massage, reduce pressure next time or shorten to 30 seconds while still performing the diaphragmatic breathing. Soreness should not persist beyond a day. If it does, or if you notice swelling, bruising, bleeding, or a new lump, discontinue the technique and seek medical evaluation. If you have a history of pelvic surgery, implants, or significant vascular disease, talk to your provider before beginning. If you experience sudden changes, new numbness, sharp pain, unexplained bleeding, or signs of infection, seek immediate medical attention. This routine is intended to be supportive, not diagnostic or curative for specific medical conditions. Let me walk you through one full narrated session so you can picture it. Start by washing your hands. Choose a comfortable position. I'll sit on the edge of a chair for this example. Warm a few drops of coconut oil between your palms. Place 2 clean fingertips on the area between the scrotum and the anus. Take a slow breath in and out to relax your shoulders. Apply gentle pressure, like checking a ripe tomato. You should feel soft give, but no sharp pain. Begin slow circular motions, keeping the rhythm steady. Count quietly to 30 as you go clockwise, keeping the pressure even and your shoulders relaxed. After 30 seconds, switch direction and circle counterclockwise for 30 seconds. Alternatively, if you prefer a press and release rhythm, press for 5 seconds, release for 5 seconds, and repeat 6 times. At the end of the minute, rest your hand and take 5 diaphragmatic breaths. Inhale for 4 counts, hold for 2, and exhale for 6. That's your 1-minute routine. It's intentionally short, so you're more likely to do it nightly. Let's address a few common questions. Is this technique sexual? No, the goal is physiological and restorative, improving local circulation, reducing pelvic tension, and supporting nerve responsiveness. Language matters, and we'll keep this clinical and respectful. Will this fix every issue men over 50 face? No, it's one safe, low-cost tool that can help as part of a broader approach. Think of it as part of a toolkit that includes movement, good sleep habits, hydration, and your routine medical care. Can you combine this with medications or other therapies? Generally, yes, but discuss changes with your prescriber. Never use this as a reason to stop a prescribed medication or to avoid recommended medical procedures. You might also ask about frequency. Once a day is the baseline recommendation, preferably at night. If you find benefit and enjoy the ritual, some men do a short repeat in the morning, but start with a single nightly practice to gauge how your body responds. If you have concerns about privacy, know that many men choose to do this routine in the bathroom or bedroom with a towel for discretion. Use whatever setting feels safest. You can also perform the motion through a thin layer of clothing if you're particularly sensitive about touching the skin directly. It won't be quite as effective as direct contact, but it's an acceptable alternative while you gain confidence in the technique. A final note about expectations and self-care. There's a cultural tendency for men to wait until a problem becomes unbearable before seeking help. This 1-minute ritual is about permission to care for your body with dignity and practicality. Many of the men I see have spent decades caring for families and careers and are now learning that small, consistent acts of self-care can rebuild confidence and comfort. This is not about vanity, it's about function, sleep, and being comfortable in your day-to-day life. To recap the practical steps in a concise form so you can commit to the 3-week challenge, wash hands, warm a small amount of oil if desired, sit on the edge of a chair or lie with knees bent. Locate the small external spot between scrotum and anus, apply gentle pressure like a ripe tomato. Perform slow circular motions for 30 seconds each direction, or do 5-second press-release cycles for a total of 60 seconds. Finish with 5 diaphragmatic breaths, 4-6, and aim to walk for 10 minutes after dinner. Do this nightly for 3 weeks and track simple outcomes like nighttime awakenings, sleep quality, and pelvic comfort. If you're ready to try this challenge, type READY below and tell me one small change you'll commit to tonight. If this message helped you, please subscribe for more straightforward, science-informed tools for men's health and like the video so other men can find this approach. Share this with a friend who might appreciate a simple, private option they can try. And finally, a clear safety reminder. This information is educational and not a substitute for personalized medical care. If you experience pain, bleeding, sudden changes, signs of infection, or have had recent pelvic surgery, consult your healthcare provider before attempting this technique. Do not stop or alter prescribed medications without your clinician's guidance. If you have any questions about whether this routine is appropriate for you, bring them up at your next appointment so you can proceed safely. You've cared for others for years. Now give yourself permission to invest 1 minute before bed. Small, consistent steps can produce meaningful returns. Thank you for trusting me with your time. I'll see you in the comments, and I'll follow up with more practical tips based on the questions you post. Type ready if you're in, and good night.